Cortisol is often the first thing people think about when they hear the word fatigue, but its role in keeping your heart beating and your blood flowing is actually what keeps you upright throughout the day. When we talk about adrenal insufficiency, the focus usually stays on energy levels, yet the cardiovascular system is where some of the most disruptive symptoms actually show up. Think about that sudden wave of dizziness when you stand up, or the way your heart starts racing for no obvious reason. These aren't just random glitches, they're direct consequences of how a lack of adrenal hormones destabilizes your internal plumbing.
It's a massive misconception that the adrenal glands only deal with stress in a mental sense. In reality, cortisol is a master regulator of vascular tone. It acts like a volume knob for your blood vessels. Without enough of it, those vessels lose their snap. They don't constrict or dilate as efficiently in response to changes in position or temperature. This is why many people with adrenal insufficiency feel like their body is constantly struggling to catch up with basic physical movements.
That idea of vascular tone is fascinating because most of us assume blood pressure is just a matter of how hard the heart is pumping. But you're saying it's just as much about the pipes themselves and how they react. If cortisol isn't there to give those blood vessels that snap, what does that actually look like on a physiological level?
Physiologically, cortisol has a permissive effect on other hormones, specifically catecholamines like adrenaline and norepinephrine. Think of it this way. Adrenaline is the signal that tells a blood vessel to tighten up, but cortisol is what makes the vessel sensitive enough to hear that signal. According to research published in journals like Clinical Science, glucocorticoids enhance the responsiveness of the smooth muscle in your arteries. When cortisol levels are low, your blood vessels effectively become hard of hearing. The brain sends the signal to constrict because you just stood up, but the vessels don't react quickly enough. Gravity wins, blood pools in your legs, and suddenly you're feeling lightheaded or seeing spots.
So that explains the dizziness when standing, orthostatic intolerance. But what about the people who actually have high blood pressure? It seems counterintuitive. If you're missing the hormone that helps vessels constrict, wouldn't your pressure always be low?
That is one of the biggest myths in endocrinology. Adrenal insufficiency doesn't grant you immunity from the rest of your biology. You can have essential hypertension, kidney issues, or even be on a replacement dose of steroids that is slightly higher than what your body needs at that moment. Data from the Cleveland Clinic highlights that overtreatment with glucocorticoids, like hydrocortisone, can actually drive blood pressure up. Plus, the body is a master at overcompensating. If your circulation feels unstable because of low cortisol, your sympathetic nervous system might flood the system with adrenaline to keep you from fainting. That surge of adrenaline can cause a temporary spike in blood pressure and that wired but tired feeling people often report.
The wired but tired state is such a specific, uncomfortable experience. It sounds like a survival mechanism that's gone into overdrive because the primary stabilizer, cortisol, isn't doing its job. You mentioned another hormone earlier, aldosterone. How does that fit into this cardiovascular puzzle, especially since it's not always affected in every type of adrenal insufficiency?
Aldosterone is the salt manager. It tells the kidneys to hold on to sodium and get rid of potassium. Since water follows salt, aldosterone is the primary driver of your actual blood volume. This is where the distinction between primary and secondary adrenal insufficiency becomes critical. In primary adrenal insufficiency, or Addison's disease, the adrenal glands themselves are damaged, so you lose both cortisol and aldosterone. That leads to severe salt wasting, low blood volume, and often chronic low blood pressure. However, in secondary adrenal insufficiency, which is usually caused by issues with the pituitary gland, the body's salt-regulating system, the renin-angiotensin-aldosterone system, usually stays intact. These patients might have plenty of blood volume but still feel dizzy because their blood vessels lack the cortisol-driven tone we talked about.
So if you have secondary adrenal insufficiency, you might have enough fluid in the pipes, but the pipes are too loose. If you have primary, you have loose pipes and not enough fluid to fill them. That explains why the symptoms can feel so much more crash-heavy for someone with Addison's.
Precisely. And that lack of volume in primary adrenal insufficiency makes things like heat intolerance much more dangerous. When you get hot, your body naturally dilates blood vessels to dump heat through the skin. For someone with low aldosterone and low cortisol, that vasodilation is like opening a massive drain in a system that's already low on water. Your blood pressure can plummet. This is why the Addison's Disease Self-Help Group and other organizations emphasize the need for extra salt and fluids in hot weather. It's an attempt to manually prop up that blood volume when the hormones aren't doing it for you.
It's not just about comfort, it's about basic physics. If the fluid levels are too low, the heart, has to work significantly harder to get oxygen to the brain. Does that explain why heart palpitations are so common? Is the heart literally just trying to beat faster to make up for the lack of pressure?
That's a huge part of it. When blood pressure drops, the heart rate typically goes up to maintain what we call perfusion, the delivery of blood to organs. If your tissues aren't getting enough oxygen because the circulation is sluggish, the heart starts hammering away. Patients often describe it as an internal shaking or a racing pulse. It can feel like a panic attack, but it's actually a hemodynamic event. Your body is using its last resort, adrenaline, to keep the system from collapsing. The Journal of Clinical Endocrinology and Metabolism has noted that this high adrenaline state is common when cortisol levels are inadequate to meet the body's demands.
Which leads to that feeling of being perpetually on edge. Let's talk about brain fog in this context. Usually we think of brain fog as a cognitive or metabolic issue, but could it actually be a circulation problem?
It absolutely is. If your cardiovascular system isn't maintaining steady pressure, your brain is the first organ to notice the dip in perfusion. It's like a dimmer switch on a light bulb. When the voltage drops, the light flickers. Cognitive tasks require a lot of blood flow. If your body is struggling just to keep you upright, it's going to prioritize basic motor functions over complex thinking. That heavy feeling in the head or the inability to find words is often just your brain operating on a low power mode because the circulatory support isn't there.
That makes so much sense when you look at it through the lens of perfusion rather than just blood pressure. A single reading at the doctor's office might look normal because you're sitting still, but that doesn't tell the story of what happens when you're trying to walk through a grocery store or manage a stressful meeting.
That is why a single blood pressure reading is often misleading. Clinicians are starting to recognize that relative hypotension is just as important. If your body is used to a blood pressure of 130/80 and it suddenly drops to 105/60, you're going to feel symptomatic, even if that 105 is technically in the healthy range for someone else. Furthermore, the timing matters. Since cortisol follows a circadian rhythm, your cardiovascular stability often fluctuates throughout the day. You might feel okay in the morning right after your medication, but as those levels tail off in the afternoon, your circulation becomes less reliable.
And that leads us into the complexities of replacement therapy. We know steroids are necessary for survival, but they're a blunt instrument for a very delicate system. How do we balance getting enough cortisol to support the heart without causing long-term damage like arterial stiffening or hypertension?
It's a tightrope walk. Modern replacement protocols try to mimic the natural curve of cortisol, but no pill can perfectly replicate the minute-to-minute adjustments a healthy adrenal gland makes. Chronic over-replacement, even if subtle, can lead to increased cardiovascular risk. Research in the Lancet Diabetes and Endocrinology suggests that even slightly high doses over many years can contribute to weight gain and higher cholesterol, which are traditional heart disease risk factors. On the flip side, being under-replaced keeps you in that high-stress, high-adrenaline state we discussed, which isn't good for the heart either. The goal is physiological replacement, just enough to keep the vessels responsive and the volume stable without pushing the system into overdrive.
It sounds like patients really need to be their own detectives, tracking not just the symptoms of fatigue, but specifically these cardiovascular markers, when they feel dizzy, when their heart races, and how they react to things like salt or heat.
Exactly. Keeping a log of blood pressure alongside symptoms and activities can be eye-opening. It helps your endocrinologist see patterns that a 5-minute office visit will never catch. For example, if you're always dizzy at 4 p.m., maybe your afternoon dose needs adjusting. If your blood pressure spikes only when you're stressed, it might be an adrenaline compensation issue rather than true hypertension. Understanding the why behind these symptoms, knowing that it's about vascular tone and blood volume, changes the conversation from, "I'm just tired," to "my circulation needs better support."
The science really underscores that the adrenal glands are the silent partners of the heart. When they falter, the heart is left to do all the heavy lifting alone. Recognizing those symptoms, the cold hands, the palpitations, the heat sensitivity, as cardiovascular signals rather than just adrenal symptoms, gives a much clearer picture of what the body is actually going through. It's about ensuring the entire network, from the hormones to the tiniest capillaries, is working in harmony to keep the system running.
And that harmony is what allows for a normal life. Whether it's managing salt intake for primary AI or fine-tuning the timing of glucocorticoids to support daily activity, the focus has to remain on stability. The cardiovascular system is remarkably resilient, but it requires the right hormonal environment to function. When you provide that environment, you're doing more than just stopping a dizzy spell. You're protecting your long-term heart health.
It's clear that the link between our adrenals and our hearts is much deeper than most realize, moving beyond simple fatigue into the very mechanics of how we move through the world. If you found this look at the science of circulation helpful, please share this episode with someone else who might be navigating these symptoms.